Hereditary hemochromatosis by Whitney, Jake, and Juliet.
What is hereditary hemochromatosis? Hereditary hemochromatosis is a disorder that causes the body to absorb too much iron from the diet. The excess iron is stored in the body's tissues and organs, particularly in the skin, heart, liver, pancreas, and joints. Early symptoms of hereditary hemochromatosis can include extreme tiredness, joint pain, abdominal pain, weight loss, and loss of sex drive. As the condition worsens, affected individuals may develop arthritis, liver disease, or liver cancer, diabetes, heart abnormalities, or skin discoloration.
The gene that causes hereditary hemochromatosis, also known as HFE, is on the chromosome 6. Hereditary hemochromatosis is a point mutation that occurs in the 6th chromosome. In most cases, the result from the common mutation in this gene is C282Y, but other mutations that causes this disease have also been identified, including one known as H63D. The HFE protein regulates the production of a protein called hepcidin. Hepcidin is produced by the liver, and it determines how much iron is absorbed from the diet and released from the storage sites in the body. Hereditary hemochromatosis is a disorder that causes the body to absorb too much iron from the diet. The excess iron accumulates in and eventually damages the body's tissues and organs. This mutation alters the shape of the protein, therefore these mutations prevent the HFE protein from interacting and the iron regulation is disrupted.
How frequent is hemochromatosis? Type 1 hemochromatosis is one of the most common genetic disorders in the United States, affecting about 1 million people. It most often affects people of Northern European descent. The other types of hemochromatosis are considered rare and have been studied in only a small number of families worldwide.
How is hemochromatosis inherited? Hereditary hemochromatosis is normally in types 1, 2, and 3 inherited in an autosomal recessive manner. This means that both copies of the gene in each cell have mutations. Often this is due to both parents carrying the gene but not showing any symptoms or effects. This usually leads to a 25% chance of inheritance. In rare cases, also known as type 4 of hemochromatosis, it appears in a autosomal dominant inheritance pattern. It only takes one parent to pass the disorder to offspring, resulting in a 50% chance of inheritance.
Let's take a look at the HFE gene chart. As you can see, the non-pathogenic mutations in this disorder all go to non-polar. So as long as the gene is mutated or stays non-polar, it will not cause the mutation with the disease. But as you can see, the pathogenic mutations all change to either polar or positively charged. We can see that the correlation to the protein in water changes the shape of the protein, which changes the function, which means that the disease is caused when the protein is either polar or positively charged, but it will not be caused and be non-pathogenic when it goes to non-polar or stays non-polar.
How can you diagnose a disease? Doctors usually diagnose hemochromatosis based on blood test results. Doctors may first suspect hemochromatosis based on a medical and family history, a physical exam, and blood tests.
Prognosis and treatment options. Hereditary hemochromatosis is still a very serious and often fatal disease. Cumulative survival for untreated or undiagnosed people stands at 76% until 10 years and a 49% chance of living until 20 years. This shows how drastically the percentage of survival decreases in these 10 years. The percentage gets lowered even more if you suffer with cirrhosis or diabetes. A common treatment option for hemochromatosis is phlebotomy, which is the drawing of about a pint of blood at a time on a regular schedule. It is the safest and most effective way to lower stores of iron in the body. With treatment, a patient of hemochromatosis can live a long, happy, and healthy life without suffering the effects of the disease.